Hello everybody, thank you for taking the time to watch this video. The following presentation has been produced by Line Health, formerly known as Worcester Street Surgery. This video is designed to run alongside our online blood pressure management service known as InControl, and we would suggest that you use this alongside the advice from your healthcare professional. Hello there, this is Dr. John Woolley, one of the partners here at Line Health. Firstly, I'd like to thank you for taking the time to watch this presentation, which is designed to introduce the concept of cardiovascular risk. I personally feel understanding this concept is really important because it underpins the logic behind why we check blood pressures in the first place, why we bother to check your blood for cholesterol and glucose, and why we ask you a series of questions about your lifestyle. So let's first discuss what risk actually is. I like to look at risk in terms of the likelihood that an adverse event will happen to us. And just to prove my point, I'd like to use an example of something that we do on most days. That is crossing the road. The main aim of crossing the road is to get safely from one side to the other. We often associate the main risk of crossing the road of being knocked down, either by a car, a bus or a bike. So let's have a look at what makes crossing the road risky. Let's first look at things that are outside of our control. It can be difficult to judge the speed of an oncoming car. We often have no idea whether the driver's concentrating or how skillful they are. And we also don't have any idea about whether the car is working properly, whether it's been serviced, whether the brakes are as good as they can possibly be. These are all things that to some extent are outside of our control. But there are things that we can do to help make crossing the road less risky. For example, I think it's fair to say that crossing 3 lanes of traffic on a motorway is far more risky than crossing a single carriageway road in most circumstances. We can choose to cross on a straight rather than from behind a parked car or on a bend. We can use a bridge, we can press the traffic lights to help us cross, and we can pay full attention at all times to the road and its surroundings. What we're primarily talking about is your risk of a future heart attack or a stroke. In a few minutes I'm going to explain to you some of the factors that contribute to whether we have a high or low risk of a future cardiac event. So let's remind ourselves of what blood vessels actually are. It's really important to simply see blood vessels as being like a tube or a pipe. As with all tubes or pipes, there's a wall and there's a hole in the middle, which is the space through which blood flows. Blood vessels transport blood from one part of the body to another, and what we're trying to do is to ensure that this process happens as efficiently and safely as possible. I'd now like us to look at the same blood vessel but from a slightly different angle. And as you can see, this vessel once again has 2 walls with a nice gap within it through which the blood flows. But if this vessel gets damaged because the blood pressure is too great or the cholesterol is too high, then the same blood vessel becomes more irregular. The gap is much less. The flow, which would have been nice and smooth, becomes rather turbulent. And it's this process that puts us at risk of cardiovascular damage. So what happens when blood vessels become damaged? To answer this, it's important to remember that blood vessels transport blood to lots of different places. If we damage the blood vessels around our heart, we're more likely to get angina. If we damage blood vessels going to our brain, we're more at risk of things like strokes or even types of dementia. But it is vital not to forget that we have some very sensitive blood vessels that supply our eyes and our kidneys. And the same process that happens around our heart can happen in any blood vessel. So when we talk about cardiovascular damage or cardiovascular risk, we're talking about damage to blood vessels, and it can happen in any part of the body. So now we know how heart attacks and strokes happen, let's talk just a little bit about some of the risk factors that can make that event more likely to happen. When we talk about health risk factors, we like to divide them into two main areas. Firstly, risk factors that we can do something about. These are known as modifiable risk factors. As you will probably be aware, things like smoking, how much alcohol we drink, how much exercise we do, are a number of risk factors that we can actually do something about. And that's why it's so important that we ask you about them. There are some risk factors that can't. Common examples include close relatives developing heart disease or strokes at an early age. We define early in a male as before 55 and in a female before 65. We also can't help whether we're male or female. We can't stop the fact that we're getting old. And our ethnicity is predetermined. And even though we can't do anything about them, it is important that we know about them so that we can get an overall picture of your health. Now, there's no question that some risk factors are more risky than others. So how do we define your individual cardiovascular risk? The first and most important factor is actually collecting accurate information. The whole purpose behind filling in our lifestyle questionnaire, behind filling in your blood pressures accurately, and by going away and getting your bloods taken, is to enable us to get accurate information. We will hopefully have asked you about a family history, and we should already know your age and sex. The other thing that's important in defining somebody's cardiovascular risk is to make sense of all of this information. In the review summary section, we will discuss how we can put a calculation onto your cardiovascular risk, and perhaps more importantly, some of the measures that we can use to try and reduce this.